Welcome. I'm Ray Barrett, the CEO of the Telehealth Certification Institute, and you probably had to jump into providing services online ever since COVID-19 hit, just like everybody else. And you may not have felt prepared, or after jumping into it, may have realized that you weren't quite prepared. The main task of the professional associations is to help you prepare for these situations and to provide you the competencies of providing services in different ways. The National Association of Social Work, the Association for Social Work Boards, the Council on Social Work Education, and the Clinical Social Work Association all got together in 2017 and contributed to providing a document that lays out the competencies of using technology in social work. The document is called Technology in Social Work Practice Guidelines. If you haven't taken a look at that yet, definitely read through it thoroughly. It has a lot of great information. There's four main sections to this document. One is providing information to the public through electronic means. The other is developmental and delivery services. That has to do with providing services directly to clients. Then there's gathering, maintaining, and storing and accessing client data. So that's using electronic records, electronic systems to maintain your records. The last one is educating or supervising social workers, because it's the job of educators and supervisors to be on top of these things and to understand how to prepare those coming up in the field in terms of using technology in a competent way. We at the Telehealth Certification Institute, it's our main job to help clinicians like yourself be fully prepared for providing telehealth services. So in terms of this document, we're going to focus on the second section, which has to do with direct service delivery, right, to clients. And in this section, with the document that was created for you by these professional associations, again, a joint effort, some of the things that they cover is the ethical use of the technology when providing services directly to clients over the internet. The other is the legal aspects of doing so. That has to gets into licensure law and other laws regarding that. Another is the informed consent. Obviously, when providing services remotely through telehealth, the informed consent is going to look a little different. You may have an additional informed consent or an addendum. The next thing is the benefits and drawbacks, or potential benefits and drawbacks, we should say, of providing telehealth services. Right? We ought to know those things so we can maximize the benefits, limit or eliminate the drawbacks. The other thing has to do with assessing the potential client's ability to use technology. It has to do with screening for fit for use. The other piece is very important, which has to do with assessing your own competence in your use of technology for healthcare, and then knowing what to do from there when you figure out, like, am I competent in areas? Am I not? Am I lacking in certain ways? And where do I go from there? How do I develop that competence? The thing about the duty to only practice within one's boundaries of competence and to assess one's boundaries of competence is tricky, because it's hard to assess your own competence if you don't know what the competencies are. So this document helps cover those things. The other thing is confidentiality, right? Our clients put a lot of trust in us to hold very sensitive information. And when we use technology, there's definitely risks to the privacy of their information. Um, the other one is social media, right? Everyone's very active on social media. A lot of providers use it as a marketing platform, but social media was designed for a different purpose other than healthcare, right? It was designed for profit and for selling people's data. Uh, and it also creates some boundary concerns and privacy concerns. And it also has to do with self-disclosure as a clinician. So this document does cover the use of social media. It also talks about having a social media policy. Another thing with providing telehealth that you may have found is maybe you used to go to your office, like at a building, to provide professional services, and now you might be using your own personal technology or your own personal sites, like a home office. So this document also covers the competencies of using your own personal devices for work purposes. Another thing that happens with providing telehealth is sometimes there's interruptions, right? Especially on the client's end. Someone knocks on their door, they interrupt the session. So that's really a major privacy issue, right? If someone walked into your client's session, uh, it would be the same as if someone just walked in your door at your office while you're in session with the client. So how do you prepare for those, and what do you do when that happens? Another one is emergency management protocol when providing telehealth services. How is it that you do that? And these things are covered right in this document. The appropriate boundaries when using technology with clients can be confusing, and assessing the needs and strengths, et cetera, of the client through virtual means. So all of these topics are covered in section 2 of this document. One thing that I like about this document is it does go into the interpretation. However, even reading this document, it's really hard to get a full sense of what all this means. What does it look like in practice? Where does it come from? Et cetera, et cetera. So to provide you the information that you need in a way that's going to be very practical, where you can walk away feeling much more confident, we're actually providing you a free live interactive webinar with the people that created this document. Well, when I say the people, we're actually, this course, 3.5 hour course, is going to be provided by the chair of the task force that put this document together, which is Frederic Reamer. He's a PhD, and also partnering with him is an attorney, Robert Landau. And they are going to present for us on February 5th from 1 to 5 p.m. That's Eastern time. And again, it's free. It's 3.5 hours of CE. So I really hope that you can join us. It's going to be very thorough, and hopefully it will meet all of your needs. Thank you very much.